live in blood deserts, regions of the world without any access to blood, where healthcare facilities are hours to days away from the nearest stocked blood bank, leading to delays in care due to hemorrhage and severe anemia. Turkana is one such blood desert. But surprisingly, this county has reported a decline in maternal mortalities linked to postpartum hemorrhage after instituting a walking blood bank. Our reporter Elizabeth Atieno visited Turkana County to understand what they are doing differently and has filed this report.
Every day, Kenya loses 15 women while giving birth. Postpartum hemorrhage, the loss of more than 500 milliliters of blood within 24 hours of delivery, is the leading cause of these maternal deaths. Therefore, blood is very critical in saving the life of a mother. One bag of blood can bring a mother back from the brink of death. But what happens when a mother lives in a blood desert like Turkana, where access to and availability of this precious fluid is limited?
Requirement for blood in Turkana County is a total of 450 units per month. But our satellite has been able to collect close to 350. So the supply has always been lower than the demand.
That's around 140 pints of blood is the ones that we are able to mobilize.
Despite these challenges, this county, which would otherwise be grappling with high maternal mortality rates, is witnessing a gradual decline in maternal mortality rates from 1,594 deaths per 100,000 live births in 2014 to 381 per 100,000 live births in 2022.
Since we had the satellite here, at least our mortalities have really reduced. They have drastically reduced because there's availability of blood.
This has been made possible after Turkana County made blood more available and accessible by mobilizing a community walking blood bank, an innovation that is still in its research stage.
It is an aspect whereby we believe regular blood donors who have been screening and donating and we know their status, instead of them bringing blood and we store them, you let them continue, but you have their details. And so when you require blood urgently, using the power of telephone and in your speed dial, you call them, they get that blood, we quickly screen it, and then we give this patient. And we can be able to save it.
So a walking blood bank is a military concept that has been used, and essentially it employs the use of pre-screened donors.
Screening is key before blood is transfused. However, the Regional Blood Transfusion Center is located in Eldoret, 400 kilometers from Turkana, and it takes between 15 and 25 hours for the results of this screened blood to be made available. But as the clock ticks, the life of a mother in theatre or one bleeding profusely remains at risk. In a bid to improve timely and safe access to blood in emergency scenarios, the Turkana County government and its partners introduced a new aspect, the Emergency Transfusion Protocol, piloted in 2022 and implemented in August 2025.
Whenever there is need, the patient needs blood emergently, like it cannot go beyond 6 hours. We call registry-based blood donors. They come, we collect blood from them. Then we rapidly screen using hospital-based rapid screening test kits. We basically screen for the 4 transfusion-transmissible infections: HIV, hepatitis B, hepatitis C, and syphilis.
The time to cross-match, which is the time from when the clinical team requested the blood to the time that the compatibility testing was completed, we found that the time to cross-match was around 2 hours, which is really fantastic.
Close to 70% of the blood collected in Turkana is donated by secondary school students. However, when schools are closed, alternative ways of collecting blood must be found to save lives.
There seems to be an area that not many people have explored: sports. Most people are football enthusiasts. There is a lot of altruism in those people whereby they want to do good for the community. And so, like every day on 14th of February, teams within Turkana come and they donate and replenish our blood banks.
As many parts of the country continue to witness a shortage of blood, the Kenya National Blood Transfusion Services has been urged to spearhead the mobilization of community working blood banks to ensure access, availability, and safety of blood transfusion services across the country. Elizabeth Atino, TV 47.